research, and they actually split into different committees. The ethics committee, although I know there are many organizations that depend on regional ethics committees by law, but even if that is the case, you need local ethics committee to guide people and to improve the ethics sense of the organization. The second one is the Research Development Committee, which here I'm focusing on training, education, and supervision. And actually, supervision as an activity in research is very, very important and time-consuming and very much demanding on expertise. So the biggest problem, if you are having postgraduate candidates in your organization, is the supervision. But I have an idea about creating theme active groups that include senior and junior people, and I'm going to talk about that in a minute. The Funds Development Committee is a committee or a subcommittee of the Research and Ethics Development Committee, which mainly focuses on obtaining funds, whether it's internal funds or external funds, and helping people try and obtain external funds. But from personal experience, and I'm sure you would agree with me, obtaining external funds depends on previous internal funds that produce work that could be published or presented, and establishing your unit or your organization as a research active entity that will facilitate you obtaining external funds rather than being disappointed by several attempts. Equipment committee is also another very important activity of the Research Development Committee. This is another subcommittee that depends on gradually building up the infrastructure. We all face problems obtaining money, but whatever money we have should be allocated in the best possible way by talking to people who are undertaking research and also to experts in research in the organization in order to allocate the money according to the right priority, and using that to develop the infrastructure, using the infrastructure effectively by creating shared using books. So if we have an ultracentrifuge, for instance, we don't want people to clash about using it, but people need to plan their time by booking into that machine so that no one will be using it on the day. Okay, now I'm taking you to looking at funds. And if we assume we have 10, I had 18 units of funds, just an example, 18 units of monetary funds. How am I going to distribute that? Actually, by law nowadays, there are many countries that say that the expenses on research internally should be between 7 and 10%. I don't know how much of that is achievable, but whatever money we have, it needs, in my opinion, to be presented or to be spent according to certain plan. There are direct expenses. I don't know why the cursor is sometimes appearing and sometimes disappearing. Oh, here it is. Okay, so direct expenses for research and scholarly activity, that includes grants, internal grants for faculty and for students, but also development program, attending conferences and training. So all of that I consider as direct research and scholarly activity. And if we have 10 monetary units for that, 5 of this should go towards internal grants, whether, as I'll show you a plan for this. 2 should go towards student research, and 3 to 4, I would say, should go towards faculty and student development. by encouraging attending conferences nationally and internationally, and by organizing training sessions using expertise from the organization or inviting companies and even professional trainers. The second expenditure, which I would allocate 5 of the, so it's about half the previous expenditure, I would call it overheads, expenses for research and scholarly activity. Administration, librarian, the role of the librarian is very important. And the last point under overheads is library costs and interlibrary loans. The quality of library is very important. If your library isn't as developed as you'd like to, then at least make collaboration with some organization nearby that you can use interlibrary loans or allow your candidates to attend. The role of the library is core for any research. Otherwise, we might end up trying to reinvent the wheel. Also, while writing out the total expenditure, which we all like the transparency and we all write reports about research expenditure, do not forget electricity, lighting, utilities, cooling, printing and stationery, publication costs, communication. Don't forget the software program cost, like SPSS for statistics, and the programs used for qualitative data analysis. I'm putting NUDIST here as an example. The last expenditure is a full-time research coordinator. This is extremely important. Why? Because most healthcare organizations do not do full-time research. We are doing research at times that might not be continuous. Many of the experiments, I'm sure you would agree with me, many of the research activity requires continuity of time. And that is here comes the role about the full-time coordinator, which I will come and talk about it a bit later. What we require from people to provide in order to allocate an internal research fund. We need project title. And I want you to encourage, I'm sure you would agree with me, I'm just rephrasing what you had in mind. But I'm putting it in a written format that will perhaps help less senior people. Project title, and the title should try and avoid any waffle or any unnecessary or emotional expressions and go directly to what needs to be done. Names and qualifications of investigators. We need to see integration. We need to see collaboration if possible. We need to see people who are expert in statistics, others who are biochemists or scientists, and others who are clinicians. When you have that sort of integration, your application becomes more likely to succeed, whether it's for an internal or an external grant. General aims and specific objectives. I put that in bold writing because I find that most people do not see the difference between aims and objectives. Sometimes they are very different. Sometimes it's a repetition of the same thing. In fact, the aims must be written in a general way, and the specific objectives must be specific questions or experiments or targets or pieces of information that you're likely to obtain from your research. If I say an aim, example for an aim is I want to have breakfast. And when I come to specific objectives, I say I'd like to have black tea, a toast, and a slice of cheddar cheese, for instance. So the toast, the cheddar cheese, and the tea are different components of the breakfast. The breakfast is the aim, while the objectives are the specific things. If there are more objectives, then I could have another aim. But it is very wrong to actually have aims and objectives are different, or aims and objectives are more or less the same repetition of the same thing. Then introduction, brief literature review, presenting the gaps in human knowledge. Why did I put that in bold? Again, because On many occasions, people put a story, a nice story, in their introduction and literature review, but they don't lead us clearly into what are the gaps in human knowledge that will translate immediately into aims and objectives. So it is very important to remind people, juniors, trainees, that gaps in human knowledge must be clearly presented at some stage. Experimental design methods, including sample size, type, source, and feasibility. Is it easy to obtain that type of patients, or is it very difficult, and so on? Is it easy to do that particular analysis that you intend to do, or is it difficult? Do you have the equipment or not? People sometimes come and say, I'm going to analyze the phospholipid pattern in a biopsy from stomach and look at the fatty acid patterns in it. Okay, and what is the methodology you're using? He is putting something like thin layer chromatography. Obviously, you needed gas chromatography, mass spectroscopy for that. So if you're not sure, ask people who do know, especially if you don't want to fail. And I'm sure all of us want to succeed in obtaining funds. Financial, equipment, and other requirements, feasibility comments, potential limitations or problems. Don't shy away from possible problems. When you put problems that you are expecting and ways that you're likely to use to overcome these, that gives you credit to whoever is evaluating your application. Approximate period of study, potential implications. The implications is a very important term in research. And of course, before you do the research, you don't know what the implications could or could not be, but at least from your hypothesis, from your expertise or expertise of senior people in the research team, you can put some lines about implications, references, and appendices. Should not exceed the specified word. All applications must be submitted to, you need to put some governance here, and you need to put rules and regulations and make these transparent on the intranet of your organization. Of course, if there are teachers in your team or team of researchers, you need to organize with the chief academic officer. Multidisciplinary research active groups. This is a very nice idea I'd like to put in front of you. Senior and junior preclinical and clinical faculty at a healthcare organization are encouraged to form research active groups with a specified theme. Interests might include heart disease, although this is a very broad category. Cancer, again, broad category. Diabetes, hyperlipidemia, metabolic syndrome, healthcare education, you name it. Nursing strategies, according to the interest of the group. And then invite students to join. Themes are announced for students who are encouraged to join when interested. I'm finding problems with the cursor, but I hope you are following with my presentation. The themes will be focused and further developed or even changed in response to human knowledge development and interests. By collaborating preclinical, clinical, and involved, you actually create the multidisciplinary teams that would benefit, the seniors would benefit the juniors, the effort and enthusiasm of the juniors would compensate for too much business for the senior people, and ensures the quality of research. Again, collaboration. I know Professor Binnert would be focusing on that, but I can't stop myself focusing or directing you to the importance of collaboration with research active national or international organizations, and don't jump over collaboration between the biochemistry department and surgery department, for instance, internally in one organization. Just as an example, the groups are encouraged to apply for internal and eventually, please slow down people who are enthusiastic and want to put for external funds immediately as they join an organization. Yeah, they might be lucky, but the success depends on previous reports. After proving themselves in publications or presentations, external funds are more likely to succeed when accompanied by evidence of previous results. So what is the support needed for research active faculty and students? If I'm leading research in an organization, I need to make sure that statistical software program like SPSS or Stata is available. Qualitative data analysis program like Nudist is available. And again, qualitative data is neglected very much in healthcare, except for nursing, I would say. But very few doctors undertake qualitative research, although the quality of service can only be assessed by talking to patients, not by measuring the blood sugar or the blood pressure. Interactive seminars on research process and statistics. Again, use internal experts and external experts. Online databases, I did mention that before, very important, very important. The good librarian is very important because it is him who would facilitate the work of your MSc students or PhD students, or even undergraduate students. One-to-one supervisory meetings for postgraduate. This is the most expensive time-wise activity, and also it demands a very high quality of supervisors. This is the hardest problem, I would say. Research laboratory equipment, and that should be an ongoing development. We take the opinion of people, we create the booking system I mentioned, but also we should create a system of training, and also good contracts with the supplying companies. What happens when a problem takes place, how long it takes for an equipment to be repaired, are they providing us training programs, are they giving us service programs, and so on. This is all important. It's not only how much an ultracentrifuge will cost you, but how much you can keep it running and how much you can use it by different groups simultaneously without creating problems between groups. Academic and industrial collaboration. And here I'd like to say the alumni, the graduates of your organization are important. Keep contact with them. As they grow older, they grow also more senior, and they can help you creating the collaboration opportunities. Faculty development scheme and scholarship programs, which include seminars, academic writing, training, critical appraisal skills, and journal club. The journal club is very important. So I'll just jump on this. I am saying quickly, there are major projects and there are minor projects, and the numbers of major projects they are allocated a bit more money, while the minor projects are smaller amounts. The numbers are more for the smaller, because sometimes you start with an idea that as you keep going through it, you develop much more interest in the field, and also you give more opportunities for people. Involving students would give you an incentive of a bit more money. Equipment committee, as I said, we need to develop that gradually. We take the opinion of research active groups, and we need to have the maintenance contract and the training program and create the booking system, as I mentioned earlier. Conference and training is extremely important. We need to monitor, we need to advertise locally, and we need to think about which candidate would benefit most of which conference. But more importantly, as people are selected to go and attend conferences and they come back, they are invited to provide a conference report. They present that orally. So they come with summary when they are given the funds or supported to go for a conference. They come back expecting that they will present what they have attended. That will maximize the benefit to other candidates. External research funds is always great to have one external fund that could go over 3 years or more. But don't start with attempting that way. You do your work, homework first by internal funds, and you get publications, and you get oral presentations, and you get a name for your organization in research before you start applying for that. Obviously, I'm not saying don't apply, but don't be disappointed if you were not to succeed. Ideas to improve that: monitor all external fund opportunities and invite representatives of these organizations to come and talk to your candidates about previous successful projects, details of applications, and how to complete the application, and common causes of failure or success. This is extremely important. There's no place for just trying to invent the wheel here. You bring the specialists, they talk, and whatever they say, we try to follow as much as we can. Get ready for the opportunities. Don't wait for the advertising of these external funds, because time is always short. But you prepare yourself. You know that, for instance, the British Heart Foundation is advertising for problems in the heart, or in the liver, another organization, and so on. Or the WHO is releasing some opportunities for external funds about this, that in 3 months. Don't waste these 3 months, and try to have an outline of the project. Obtain publications before that from your own work. Use your own abstracts or oral presentations. Again, maximize collaboration. I'm sorry, Professor Bennett, I'm stepping on your feet, but it is very, very important, and I hope I'm supporting your presentation rather than stepping over your feet. Support the academic writing skills. This is very important. There are people who speak English, but to write academic writing is another thing. Many organizations, even in the United Kingdom, have a professional English teacher who looks at the academic writing of people and advises. But there are people who are talented in the academic writing in the organization. Your duty is to try and discover these, and don't do everything yourself. Okay. Research seminars, obviously internal, external presenters. The subjects should vary to appeal for different people. You don't keep going on community medicine only, or biochemistry only, or no, you keep varying the subjects and trying to get interest. People like to organize the research seminars over lunchtime and provide sandwich that could come out of research expenditure. I find that a very good idea. It's not expensive. At the same time, it increases the number of people who attend seminars.
Professor, sorry to interrupt. We are 3 minutes past our allocated time.
Okay, can I take just 1 minute to finish?
Yeah, of course, of course.
So, thank you very much. Statistics support, small groups for training, and should be hands-on. The journal club is also very important activity, and it should be organized. The time, the timetable should allocate for journal clubs. The technical support, as I mentioned earlier, it is required. It keeps the duties of the technical support or the coordinator is to keep research activities comprehensive record, also record of the meetings, technical support, and consultative advice. Booking system, he should create that booking system for equipment, record of chemicals available, expiry date, safe storage of volatiles, and all of that is really extremely important. I'll leave you with the ethics values, and I know everyone knows confidentiality, anonymity, beneficence, but actually there are 19 points. I've listed them here for us to think about. And thank you very much for allowing me to this lovely symposium.